João Silva Marques, an interventional cardiologist from Lisbon, and I'm going to explain you how a diagnostic coronary angiography is done.
For that, I will use this simulator, that is an interventional cardiology simulator that is transparent and in which we can see the steps that are required to do the procedure.
So this is a clean procedure. So first of all, we have to clean your skin in the places where cannula will be inserted in your arteries. So that is the first step. Then a local anesthetic is applied and a sheath is introduced in your artery. In this case, we are going to use the radial accesses, and we can discuss the advantages of radial access versus femoral accesses. As you can see, the arteries here are thinner than here, and so these arteries are much more compressible. It's easier to compress and to stop bleeding from these arteries than from these arteries in the leg, in the groin. So in the groin, you'll have to lay down for a few hours, and from the radial access you can lift and go just after about 30 minutes of compression and with minimal risks. The next step is when we have inserted the sheath, that can be in the radial artery or the femoral artery, we have to use a catheter to go along the arteries in the arm and to get to your thorax, to your chest. So let me show you how we can do that. So you have to place a wire inside the catheter, and then take the wire. The wire is advancing in the arm and will reach the chest, where we have larger arteries, and then we get to the aorta. And the coronary arteries, the arteries that we have to screen to know if there is any coronary artery disease, are connected to the aorta. And the wire comes out. This wire is used to not traumatize the arteries. There is no trauma and there is no punctures in the arteries when we use the catheter. This is a thin catheter that is highly flexible, and when we go throughout the arm you should not feel anything. Sometimes there is a little bit of pain that is due to spasm. That is when the arteries do like this, they spasm. And there is some medication that we can give you so that you can feel better about it. So when we get to the artery, we have to manipulate the catheter to get it inside the coronary artery, and then we can give contrast and see the anatomy. And we have to do several projections in order to get a good look of the coronary arteries and to tell you if there is any coronary artery disease that needs treatment or not. So thank you for watching this video. If you liked it, and I hope you did, I hope you can join me here for another video next time about other interventional procedures explained to you. Thank you.